Uh-oh, I better get started. So I'm going to start and introduce myself. My name is Irene Aguilar. I'm your senator for this area. If you don't remember voting for me, you didn't. And I didn't do anything illegal. Roma resigned to run for mayor, and I was chosen by the precinct committee people to be his replacement. So that's why. But you'll get the opportunity in November to vote for me, I hope. Right now, I don't have a Democratic primary, and there is a campaign committee registered with a Republican name on it, but he's not been active as far as we can see. So I though really want to go out and walk all the areas, and actually before I get started, just so I don't forget, invite any of you who are part of neighborhood associations to please get in contact with me or Owen or Susan and let me know when your neighborhood association will be meeting. And then if you would enjoy walking me through your neighborhood and telling me about it from your perspective, I'd enjoy that as well. I'm trying to still walk on Sundays even during this session, just because May to November is not that long of a time, and the district, while it's not huge, if I really knock on all the doors, is very huge. So anyway, so if you live in any specific district or know anyone who does who you think might be willing to take me around and tell me about the area, that would be great, because it's always fun to get an insider's view. What I wanted to do today was talk with you some about different pieces of legislation that I was running, but more than that, I wanted to first just have like an open forum, because really a town hall should be my chance to hear from you and hear what's on your mind, what you've been thinking about, and what concerns you have, whether that's related to what I'm working on or not, whether that's related to bills in the Senate and House or not. So I'm going to open up the floor first for a few minutes. Yes, ma'am.
I just picked this up and looked at it a little bit, and I'm just wondering how this is going to mesh, run separately of the plan for the exchanges and so on.
Okay. So, and I already forgot your name, you just gave it to me.
Trudy.
Trudy was asking about a timeline I have here about a plan I have for universal health care. And, you know, on Saturday night we had what somebody, I think they disparagingly referred to it as a Democratic prom. It was Colorado Democratic Party Jefferson-Jackson dinner. And the speaker was Cory Booker. And the reason I mentioned that is I had not heard him speak before, and he was quite a dynamic speaker. But he tells a story about how his mama always said to him, "Ain't nothing that's impossible." And then as soon as somebody says to him, "That's impossible," he does one of these like, you know, "There's nothing that's impossible." So this is my impossible. And this is the reason actually I'm in the Senate, is that I really do think that access to health care is a basic human right, that we end up paying for it for everybody at some point, so why not pay for it when it's cheap? And what I really want to do is get Colorado to some kind of universal health care system. I had hoped to see that in the United States after watching the debates around national health care reform. I've decided Colorado is a smaller apple that I might actually have the chance of biting and eating. And I introduced a bill related to this last year, which is why I ran for the Senate to do that. This year I chose not to run a bill in the Senate, primarily because I was warned, as you've read in the newspaper, that there was going to be a lot of partisanship, and this is really a complex subject, health care and health care financing and reform. And I thought if people aren't going to have their thinking cap on, it's not worth it to put something out there that they're not going to be able to understand. So what I'm trying to do is, on the side, I have some friends who started a foundation, and we're trying to get a grant done to do a feasibility study around how we could transition Colorado to universal health care in the state, utilizing a lot of the things that we already do well. You've probably heard T.R. Reid's movie, which he's hosting with me on March 15th, is going to focus on what's going well on the western slope. I've worked for Denver Health for 21 years, and I think they're doing a great job of doing similar to what they are on the western slope in the sense of treating everybody equally and incorporating the uninsured. And even Kaiser has a really good model for wellness care and disease care. And so I think we have a lot of basis in our state already to build on. And really even our hospitals are working toward how do we help people who don't have very much money. Of course, if you have money, they'd like that. But in the meantime, if you don't, they don't want to be in the newspaper for trying to get it from you. But this is a multi-year plan, and what Trudy asked me was, how does this mesh with what's going on nationally? So, as many of you know, the President's Health Care Act is going to be before the Supreme Court this coming spring, and we're hoping to have a decision by June. They're looking for a decision on a number of different things, the most important of which is whether the individual mandate is legal. And the individual mandate is a part of the law that says that you have to have health insurance or you'll be fined. And there's a lot of opposition to that concept. But the insurers said, look, if I have to cover everybody, then people have to pay for it even when they're not sick. Because if people only have to buy it when they're sick, nobody can afford it. Right. So that's where the individual mandate comes from. So that's one thing that'll be ruled on. And then if they say that we don't have to have an individual mandate, the next thing they'll rule on is whether the whole law stands or whether just the individual mandate falls. And then after that, they're also going to rule about whether there's actually a smaller ruling about whether you can even make a ruling on the individual mandate when we haven't even charged a fine yet, but that's a different decision. And then finally, whether the U.S. Government is putting too much pressure on states by saying, in order to get Medicaid, you have to offer it to everybody who lives at under 133% of federal poverty level. So those are the decisions that are going to be made in May or June. I don't know law well enough to say anything with confidence, except that I have a couple of friends who are attorneys who really don't see that this will be deemed unconstitutional and turned over. And then the political part of me says I don't think Obama would have called for the Supreme Court to rule if he had thought they were going to rule against him. But I'm always surprised by what happens nationally, so I'm keeping my fingers crossed that we'll move forward with national health care reform. So in terms of how these two mesh, one of the things under national health care reform that we are having to do is set up an insurance exchange in the state of Colorado. And the insurance exchange is going to be somewhere where anybody who doesn't get employer insurance can go and find out whether they qualify for Medicaid or CHP Plus, and if not, whether they qualify for a subsidy, because under national health care reform, if you earn under 400% of federal poverty level, you are eligible for a subsidy to help you buy insurance. And then lastly, to get that subsidy and get help with the caps of payments out of pocket, all will happen through the exchange. So my idea for health care would actually be able to build on that base in the sense that what I have us doing is having everybody having access to health care, ideally paid for through a payroll tax and an income tax. But we still need to figure out how much you have to pay based on your income, because it would be sliding scale based on ability to pay. So that kind of data would still be useful through the exchange. The other thing is that in my redesigned healthcare system, actually I don't completely get rid of all the insurers, I just change the rules of the game. So you could still go in there and choose to have Denver Health be your provider, or Rocky Mountain Health Plan, or Kaiser, or United and Cigna are actually doing pilot projects on medical homes and things. So you could still go into exchange and pick your plan, and the exchange could still collect data on who are they covering and what kind of care are they giving in quality. So all of that will mesh. The only thing that would be different is that what you would pay would not be a set price based on the policy, but a percentage of your income. And ideally, you'd be buying a better product that covers, has less co-pays, no deductibles, and then within which you could negotiate, depending on your diseases and what other things you needed, for how much you had to pay out of pocket, and get a limit on that as well. So it's separate, but the infrastructure will build on what's already there. So everything that Colorado does toward building this infrastructure will be helpful in terms of healthcare reform and in my vision of the future.
And we're hoping that the right-wingers won't keep true women's health care out of the plans.
The nice thing about it is that birth control compared to, say, abortion is so much more widely accepted, and even people that try and pass personhood amendments in Colorado fail all the time. So it's really I think it's just sort of sad that the extreme conservatives keep pushing on this, because they really need the independent voters in Colorado to win Colorado. And it's just sad because it shows how naive they are. I mean, if I were there, I'd say, could you keep your mouth shut, because we want to win Colorado. And they're never going to win Colorado with those extreme votes. So actually, even though it's sad for them, I'm happy. because that makes, hopefully that means we'll be there with Obama. But we can't count on that, and we need everybody to come out and vote, because the one thing that extremists do is that they vote. So we need to be sure we don't get complacent and not get out the vote. Any other questions? All right, go ahead, Diane.
Well, I had a question about your landlord-tenant bill. And my husband is a property manager.
Oh, okay.
He manages about 6 properties that he owns, and he and his brother own some of them that they inherited. And there's some changes in the law in your bill that I think are pretty burdensome for a small property manager or landlord. And I just wanted to point them out. One is that the landlord can't get into the property for 48 hours. I think it's been 24 hours in the past. And he's got a schedule with repair people and for the work that he doesn't do himself. And he likes to get things taken care of promptly, and extending of giving 48 hours instead of 24 hours. I don't understand why that would be a good idea on the landlords.
This is a great bill to ask me about, because this is, one of the things I say at the Capitol is that the lobbyists run the Capitol, because the lobbyists know all the history and what's going on, and now that we have term limits, you have people like me coming in who've not been there before. So I had a town hall last October, I think, at the Wash Park Rec Center, and I asked people to come and give me ideas for legislation they'd like me to run. And a gentleman came and said that he was really concerned about tenants' rights. And he hooked me up with this woman who's a great dynamic attorney from Jeffco Action Center who does a lot of tenant cases. And she said, oh, if we could get this Uniform Act in Colorado, it would be great. And me being a new legislator, I said, sure, and I introduced this bill. Well, what I found out is that Colorado was the 49th state to have warranty of habitability, meaning they had been trying, and they had been trying from 1965 until 2008 to get anything on our statutes to certify that a house had to be habitable in order for you to rent it. So I had no idea that I walked into the middle of a 40-year fight. I said, could someone have told me there was a big steaming cow pie there and kept me from walking into it? And,
I'm not asking about the habitability parts.
No. But anyway, I'm just telling you this, Rebecca, because that was my long-winded way of saying we're doing what's called a strike below on this bill. And what a strike below means is that you're throwing out everything you've put out there for people to see, and you're coming back with an amendment, so that whatever you see right now being published is not what we're trying to pass. Okay. And so, so that's the first thing I wanted to tell you. The second thing I wanted to tell you is that actually the part you're talking about is still in the bill, so I will address your concern. So interestingly enough, and actually I don't know how many of you know this, I have about 8 students working with me this session. 2 of them are law students at CU Boulder, and 5 of them are law students at DU, and 1 of them is a social sciences master's student. But anyway, so one of my law students used to be a realtor, and she was amazed that at the paucity of tenants laws that we have in Colorado, actually. And she came from Chicago, where they have, I guess, really tight laws. But she said that her landlord has literally just come into her apartment when she was there without having to ask permission or anything. And, no, you can, actually. There's nothing in Colorado law that prevents you from doing that. Most people, like your husband,
24 hours.
Right, don't do that. But unfortunately, it's not against our law to do that if you'd like to do that for some reason. And so what this law said is that if you want to go into a landlord's apartment, you have to give them 48 hours notice. But it does say, and what our part will say, is that if you're working to fix something, that the tenant's supposed to work with you about getting access. So this is just like your husband for some reason wants to go in and look at that apartment and make sure they're not trashing it, he has to give them 48 hours notice. But if there's cause to go in, he can negotiate and do that at another time. So we are keeping access in there, but it's not for any access. It's for like random access, not for you need to fix something kind of thing.
Okay. The other question I had, if I could ask it, is,
Can she talk a little louder?
oh,
so
okay,
that
I'm
we
sorry,
can-
return of the security deposit. The new law says that you have to return the security deposit within 1 month. And depending on when the tenant vacates, that's a very short amount of time for somebody that's working on 5 other units, or the sprinkler systems have to be turned on. And he got rid of one tenant who had a trail house. Well, the house smelled so bad that they had to go in and clean before he could even take a look at what damage there might have been. And
So-
it used to be 2 months, and
Right.
now it's 1 month.
So that's one of the things that will not be in the strike law. We are not going to be changing the return of security deposit. But it's an interesting dilemma for people who are living more on the edge of poverty, because often they don't have enough money to rent their next apartment and to put down their down payment until they get their security deposit back. And so we were inclined to try and switch it from 60 to 30 days if we could, to allow for people to change tenancy if they want. But in our strike law, we didn't make that change. We're going for some of the other things that are more basic, like access and disclosure. Actually, there's nothing in Colorado law right now that says that that you have to have a copy of your lease, and that has to say who you need to contact if you have a complaint. And so we want to put that into our law.
Yeah,
And those are
good
basic things that I think good landlords do already, but
Yep.
unfortunately, not everybody is a good landlord.